On this episode of 26 Minutes with Dr. Warren Siegel, I'm joined by Dr. Tanveer Mir, a distinguished leader in internal medicine, geriatrics, and palliative care medicine. Dr. Mir has dedicated her entire career to advancing patient-centered care, particularly for aging populations and those facing chronic illnesses. She is currently the chairperson of the Department of Medicine at New York City Health and Hospitals, South Brooklyn Health, a role that she has held for the past 2 years. Prior to that, she served as chairperson of medicine at Wyckoff Heights Medical Center for 7 years, guiding clinical teams and shaping healthcare delivery in Brooklyn. Dr. Mir earned her medical degree from the University of Kashmir in India and completed her residency in internal medicine at Long Island Jewish Medical Center. In addition to her clinical and leadership roles, Dr. Mir has been a key voice in medical education, bioethics, and policy, having served as chair of the board for Regents for the American College of Physicians. She has also led major initiatives in supportive oncology, hospice care, and integrative therapies to enhance patients' quality of life. Today, she joins us to discuss an important and very relevant topic: how to stay healthy as we age. With decades of experience in geriatric care, chronic disease management, and palliative medicine, Dr. Mir will share practical advice on maintaining wellness, preventing common health issues, and making informed healthcare choices as we grow older. Dr. Mir, it's such an honor to have you on the show. Thank you for taking time out of your busy day.
Thank you, Dr. Siegel. We are kind of, the two markers, the pediatrician and the gerontologist, I think, and life is in between. So I think the aim is to have healthy aging, to see all the functions are preserved. You can think, live, enjoy life, and there's a lot that can be done.
So here, let me start off with the obvious question. Where are you from? We talked a little bit about going to medical school in India. And how did you get involved with the things you're doing?
I came to the United States after my graduation, and I've been involved in internal medicine. I was very fond of, the elderly patients in the practice and in the hospital. And from there on, just talking to patients and knowing their lives, knowing their backgrounds, the person behind the diagnosis was always very interesting to me. And so that started the beginning of something that was a very enjoyable and also professionally very rewarding place where you can help people when things can be brought back to a certain norm, and step by step you bring them back to where they can function, they can be contributing members of society, and they have a wellness in them.
So, it sounds nice, but it really is very different than what most of us think about going to a doctor. When we think about going to a doctor, it's because I'm sick, it's my asthma, it's my high blood pressure, it's my diagnosis. You're saying that you're drawn to people because of who they are.
Correct. So the personality of people is very important because it's been shown that people who are connected with communities, with education, with family, with a religion, or let's say a church or a faith-based organization, where they play bingo, they have longevity, they have better quality of life, they eat well, they live well, they sleep well, and depression never touches them for the most part. So I think from a quality of life standpoint, the person behind the illness is always important. And we should never look at it as, all these chronic illnesses impairing anything, because if lifestyle can be managed or maintained, then things are really good, the quality of life is good. And that can be started very early. For example, at age 70, you don't start thinking that now you gotta live healthy. You've got to do that much earlier. The human body goes through many changes over time. With each decade comes a little bit of, stiffness, a little bit of loss of height. They say your ears get longer, your nose gets, these are all things that happen to the body. But at a metabolic level, at a functional level, there are changes that happen. But what makes a difference is the chronic diseases like hypertension, diabetes, arthritis. If they're managed well and you're able to keep a reasonable BMI or your body weight index is good, if you're able to play a few board games or a game of chess, if you're able to socialize, the quality of life will be much better.
So we know that treating a disease early, obviously making the diagnosis, getting treatment, getting appropriate medical care, being in primary care, makes you healthier. You're saying it also extends your life.
Correct.
So is it true that people are living longer?
People do live longer. You know, life expectancy was going up even in the United States. It was up to 84 years, but then, you know, COVID hit, so we lost some years there. But I think we're regaining, and the average lifespan is 77 years, and it will continue to improve over the next few years once we get over this hump. There are places like in Japan, there is an island, and on that island there are many centenarians. And similarly, there is a village in Italy where they see a lot of centenarians. So what happened here? It's the same genetic pool, people who kind of live in that climate, which is beautiful. They take care of themselves, and what's been shown is they watch the diet. They watch what they eat. The diets are mostly Mediterranean type diets or plant-based diets for the Japanese. They walk every day. They have some kind of an activity, mental games and all of that, different things, that the board games that they play. And all of that has shown that to this date, they have preserved their energy, their cognition, their function, and some of them even run marathons.
So I've got to watch my diet.
Correct.
I've got to keep my blood pressure down.
Correct.
I've got to exercise. We're hearing this over and over and over again. Why is it so hard for all of us to do that?
Because growing up, we were told that, you know, food is food. Okay? I think there was a time when preserved food coming from a can were the best things because they were easy. Then over time we realized that too much salt, too much sugar, too many additives, you know, all these things are not good for you. The plastics that carry all of these aren't good for you. They go to your circulation, they cause damage. And then there are many carcinogens or, you know, elements that can cause cancer. Smoking, many of us have quit smoking and we don't see us not smoking anymore, but it's still there. Smoke, inhalation, things that are outside of us, that's important. Vaping, we think vaping is safe, it's not. It causes damage to the lungs. So all these things at an early age you have to start preparing, and then you live to 80, 90, or maybe 100.
So I noticed you didn't talk about alcohol. I've heard varying things. You should have a couple of red wine is good, white wine isn't as good, you shouldn't have any alcohol at all. What's the current state? What's the recommendations?
I think everything in moderation works well. Like it's just like the salt, too much salt, too much sugar. A little bit of it won't hurt you. But for alcohol, it's been shown that up to 30 ml of red wine per day doesn't harm you. It gives you some extra benefit, some longevity, and it also helps you with your some of the antioxidant features. So, which means you're less prone to hypertension, less prone to diabetes, and coronary artery disease. So if you do all of that in moderation again, 30 ml, I think the road will be good for you.
And 30 mLs is how much?
It's
That's much smaller than a wine glass, right?
Correct. It is smaller than
So
wine glass.
really, you're not saying stay away from all of this stuff. You're saying moderation.
Moderation.
And you're saying to incorporate things like nutrition, exercise, stay away from all tobacco products, including vaping. I'm glad you mentioned that because that seems to be on the rise in so many neighborhoods. But you're saying we're living longer in the United States.
We are, and you know, immunizations, cancer screenings, sanitation, quality of life, control of different infections due to antibiotics, all these things have really shown an improvement. We were doing really, really well up until COVID, and of course the world took a hit, but hopefully we should regain all those things, and prevention is better than cure.
So talking about prevention, it means that everybody should be seeing their primary care doctor. I don't care whether it's once a year, twice a year, but not seeing a doctor just doesn't help anybody, right?
That doesn't help anybody because, you know, you go to a doctor, just make it a social visit, talk about how you feel, what bothers you, what keeps you up at night, things like that. So it's not just the physical, like ruling out hypertension, diabetes, going through basic cancer screenings, which are age appropriate. But it's also about how do you feel mentally? How do you feel? Do you have fatigue? Do you have energy? Do you feel lonely? Things like that. Because depression and mental health issues are on the rise, and it's because people don't have the time to express what they don't want. But the primary care doctor is the best person who can see you, who can evaluate all these things, and then they can tell you what is the best remedy for you.
Now, as I mentioned in the intro, introducing you are a specialist in geriatric medicine. What is geriatric medicine? And I hate to ask this, at what age should I start thinking about seeing a geriatrician, a specialist in geriatric
Right.
medicine?
So Medicare defines 65 as a cutoff age, and that's the age that's been used for geriatrics. Now we know that at 65, many people look young, feel young. So some people have said it should be adjusted to 70. But by definition, 65 and above, you can see a gerontologist, or you could see a good primary care physician who will assess all these domains, like do a comprehensive evaluation, make sure your gait is good, your thinking is good, your thought processes are in the right place, and then your medication management is optimal, whether you have hypertension or diabetes, or you don't take any medication at all, which would be the best thing. And your BMI, and lifestyle medicine is coming back. There is a newest specialty in medicine, it's called lifestyle medicine. It's about how you live, what you do, what you eat, how do you play, how do you live, partnerships, associations, work, balance, all of that. So I think lifestyle is very important in longevity and in geriatrics too. But going to your doctor once a year is a must.
But we don't have to see necessarily a geriatric specialist just because we turn 65, right?
Correct. You can do the annual visit, and you'll be good enough with that. And also, we don't have enough gerontologists in the country because, there are a lot of patients in facilities, long-term facilities. There are all different kinds of adult home models and all of that. So they're not enough to staff all of those. But a good primary care physician can take very good care of you.
At what point should I say I want to see a geriatric specialist or start Googling gerontologists, geriatric physicians in my neighborhood?
65, as I said, is a recommended, but if you're 70 and you feel good, you can try that at that time. Because things like memory screening, because even with memory disorders, it's been shown that it could be missed in a primary care visit. Because they go through the routines and all of that, unless you're tested or screened for that, it will not be picked up. And picking it up early also provides a lot of support. It provides a lot of longevity and care in the long run, that medical therapy that's coming up. So I think all of it is prevention, defining issues, and trying to optimize your care based on that team-based model.
Interesting, you mentioned memory screening. What does that mean?
So all of us read and write based on our educational level. Memory is something we all have, but then learning is book knowledge, college level, high school level, all of that. But there's some very simple tests. For example, I'll give you a simple test. We call it the clock drawing test. You take a clock and you draw it. Clocks are common to every language. They are naive of your high school, college degrees and all of that. So if there is a memory issue, you can have an issue where if I tell you draw 3 p.m., you draw a clock and the numbers are outside, or the hands are different. And it's not showing 3 p.m., it's showing 9 p.m. So those distortions, early distortions, can be picked up by these things, and we can screen you for that and then refer you to a memory specialist. So those things can be done. They're preventive, they provide a better quality of life, and there's team-based management.
Wait, so it's not a blood test, it's not a shot, it's not a surgery, you just do a piece of paper, pencil and paper
Correct.
test to determine if I'm having issues with my memory?
Correct. It's a screening test, and if the screening test is positive, then you go for diagnostic tests, some of which may be blood tests. We do have some tests available for Alzheimer's type of dementia. That's just one kind of dementia. But for the other ones, you screen, and if somebody's blood pressure is high, we need to control it better. If the lipids or the cholesterol are high, we control that. And all of that are memory preserving or brain preserving methods.
This is fascinating. I want to continue this. I have memory issues all the time. I can't remember what I had for breakfast. I don't remember if I had lunch. Isn't it normal to forget things as you get older?
Right. So as we age, there's a little bit of, what we call benign forgetfulness, which means that you forget where you kept your car keys or something like that, but you get to it. You retrace your steps and you get to it. It's also based on, what's on your mind. If you're doing 5 or 10 or 17 things at the same time, it may be harder to capture all of that and go through all those steps. So, but let's say if you're going home and it's from rote memory, you don't put it in your GPS, you're going home. But if you get lost once, twice, 3 times, then you have to really get evaluated because you're forgetting your landmarks and your memory is not there. Those cues aren't there. So that's important. But simple things like, where did I keep my pen? Where did I keep my pencil? Or I missed an appointment. Those things happen with age. It's benign forgetfulness. It's a little, but it is of concern if it happens repeatedly, someone else points it at you, or if you look at it that you didn't balance your checkbook or you forget your bills repeatedly. If it's a pattern, then it's picked up. But very often they go undetected. So screening is good.
I had a friend who said to me recently, I said, it drives me crazy. I come home, but I can't remember where I put my car keys last night in the morning. And he said to me, that's not a sign of Alzheimer's. It's when you find the keys, but you don't know what it's for. Correct. That's really scary.
Absolutely, the association. So what you do with the car keys, you may take them in your hand and you look at it like, what do I do with it? So that tasking, the multi-step tasking, is a complex phenomenon in the brain. So you lose some of that association. But the key is a key, you kept it here or you kept it on a table, a different table, that happens.
So what should somebody do if they're worried about one of their loved ones and saying, listen, they're getting older, I'm concerned about their health, not just mental health. Maybe it's mental health, maybe it's their health in general. What should they do?
So, as I said, going to a primary care physician or a gerontologist is important. They'll do some basic, physical evaluation, some screening tests and all of that. If there are any chronic diseases, they have to be managed better. For example, diabetes, hypertension, any kidney disorders, any, joint disorders, things like that. Minimize medication. And then if they are taking medication, make sure there's some supervision, because people either forget to take the medication or they take it incorrectly. Very often you'll find people taking 2 meds at the same time and then nothing at bedtime. So they were supposed to take 1 pill in the morning, 1 at night. So pill boxes are very important. Having a schedule is very important. In general, it has been shown that when seniors have a schedule, for example, they get up in the morning and they go to a day program where they're with other seniors, and even if they're playing bingo or having dinner or whatever, they're socializing, they tend to be very much task oriented and stay healthy physically and mentally. But if they're loners and staying at home, then their physical condition declines, their muscle strength declines, they're sitting in one place, there's no one to accompany them for a walk or anything, the socialization isn't there, so the brain stops thinking too much, and so that is a general decline in all areas. So what's recommended is day programs, socialization, and if you look at some healthy aging pictures, you'll see at the curbside groups of seniors sitting and playing chess or playing some board games. Those are very healthy things. In fact, board games are recommended for everyone because they stimulate the brain. They're based on your memory, so whatever you learned in that game, whether it's Scrabble or whatever it is, it just keeps your brain going. And then too much TV isn't good for you either, the blue screen and the dopamine issues. So again, as I said, moderation in everything. Even your medication management has to be supervised, so it has to be done properly. Get a pill box if you don't have one. Usually they've shown that if it's more than 4 medications, the compliance goes down. And there may be drug-drug interactions. You have to be careful what drug you're taking, what food you're eating with it. So you should be able to read up on that and see what to avoid while taking certain drugs.
I remember I was in medical school and I was talking to a doctor who had a lot of patients who were in their 90s and some that at the time were even hit 100. And I asked him what the difference was between his patients who were younger and the ones who made it to 90 and 100. And what could you do to make sure that you live a long life? And he told me, make sure not to fall. Don't fall. Can we talk a little bit about the environment that some of our patients, our seniors live in?
Right. So, a cluttered environment isn't good for you. Seniors do fall because there are issues with mobility, maybe issues with, balance. There may be issues with vision and hearing. So the normal cue sensory things are not there. Uh, Footwear, very important. To not wear loose-fitting shoes. Rugs, open rugs, or freestanding rugs are not good for you. Furniture should be stacked or it should be on the sides, and minimize the furniture. Toilet should be very accessible. It shouldn't be that you go through a maze to get to the toilet. So all these are a risk for falls. Having a pet, believe it or not, a cat or a dog that crosses your path or you run behind them, that's a risk for fall.
Well, that's interesting because I thought, and I'm going to say this, I'm a big animal lover. I thought that was helpful for my mental health.
It is very helpful, except when they're running around you and you can't get your way around. So that could lead to a risk of fall. But pet therapy is definitely there. It's very good for emotional well-being. It's always recommended, to have either your own pet or have a visiting pet and things like that. That's why you go to senior centers, you find a lot of pets around. It's very safe, and as long as things are hygienic, it's a very good way of getting over a bad day.
That's wonderful. I love it. I can borrow somebody's pet that I don't have to take them for a walk. I love that, and that's good for my health as I age. Let's talk a little bit about hydration. I always think about, especially in the summertime, how easily it is to get dehydrated. Even not being an older adult, why is it so difficult and important for seniors to hydrate?
When babies are there, I think you can relate to that. They have a high water content in their body, but as you get older, your fat content may be higher, your muscle may be less, and then your fluid content in the body is lesser. So what happens is you're very dependent on your circulating blood volume or your hydration status to keep up your, perfusion of the brain, your thinking, your blood pressure, your kidney function, and all of that. I think just habitually people just don't drink enough fluids. I'm supposed to drink 6 to 8 glasses a day unless you have a contraindication. So most of us also don't do that, let's put it that way. But drinking is very important because the older kidney is a salt wasting kidney. You lose a lot, you don't retain your salt. So if you're losing your salt, then you lose your water too. So that's why you need to stay hydrated, you need to stay well hydrated. And at night, I'll give you an example. People have their last meal at 7 p.m. or 8 p.m. and they have the last drink of water at that time. There's no drinking water or anything after that till maybe 8 or 9 a.m. So you have a 12-hour deficit where you could be potentially dehydrated, and that's something that's very important. So I think staying hydrated throughout the day, having smaller portions and dividing it, of course, is very important. Dehydration leads to falls as well. Dehydration leads to kidney dysfunction. Dehydration can also lead to confusional states. So all this is very important to stay well. It's not only healthy eating, but it's also optimizing the water intake or fluid intake.
And how do I know if I'm drinking enough fluids?
As long as, what they recommend is that, 6 glasses of water or 8 glasses of water is enough, depending on the size of the glass. So that's a good way of looking at it. So have a pitcher, keep it there and see if you drink all of that in a day. And if you don't, you're drinking less. The other one is that you'll feel tired all the time. You may feel that, mentally you're not as clear. And then obviously you're not going to the bathroom as much, or the urine looks darker. So all these are signs that, you need to drink more water. And when it's summer and the temperature goes up, there's more water loss from sweating, from skin losses. So for that, you have to account for extra water. You need to drink extra water because our body needs more water to prevent dehydration. So all these things are important.
So as we get older, we unfortunately lose the people that we care about, whether it's our partners, unfortunately, sometimes it's our children. Can you talk a little bit about some of the paperwork that we should be thinking about as we get older? I'm not just talking about my will, who is going to get my car, who's going to get my suit and my ties. Are there things that people should think about from a paperwork standpoint as we age?
So healthcare has become very complicated. We have the ability to keep people going on machines for a really long time. The quality of life is defined by the person. I cannot define the quality of life. You can define it. I can define my own quality of life, but I cannot define someone else's quality of life. So in that is the basic fact that some people don't want to go to nursing homes ever, or they don't want to be kept alive on machines like ventilators or pacemakers and all of that. So if that is a wish that you don't want all of that, what you need to do is you need to sign a form. It could be a do not resuscitate about resuscitation, or you appoint a proxy. You appoint your son, your daughter, your spouse, your partner, anyone in that. It's called a living will. Or it's called a healthcare proxy. Healthcare proxy is the person who will make a decision for you when you cannot make a decision for yourself, and that comes into play. If you can't do that, write a living will through an attorney that states your wishes, whether you want to be on a respirator or a trial of respirator or not. As you know, healthcare has become complicated. If things happen, our job is to resuscitate you, to do everything to keep you going. But if that was not the quality of life you wanted, you please take the time to write it down. The same is true for your assets. It's good to have a will for your financial piece, a will for your healthcare needs. And we think financially, so if you're a millionaire or billionaire, it doesn't matter. It could be whatever your assets are, you still need a will, because if you are unable to decide for yourself, where you live is very much related to your financial assets. How you're cared for is dependent on that. What care you get, like, as in a care, who's your caregiver? If there's no family member to care for you, then if someone needs to go to a facility, what would that look like? So I think speaking to an elder care attorney is critical. They are absolutely well versed with all the regulations, rules, and all of that, and they will train you. And having a living will or a healthcare proxy or a healthcare agent, someone who can discuss your do's and don'ts comfortably if you are unable to make a decision.
But isn't that expensive?
Not that expensive. There are forms that are available online, but you need to make an informed decision. And when you go, most people do go to someone for their financial affairs and do it. And in many of the states, it's tied into the healthcare proxy or the living will. All of that, both your advance directive for health and for your finances, are done by the same person.
And last question. Is that something I can talk to my primary care doctor about? Is that something that he or she would know how to fill out, find a living will healthcare proxy?
Absolutely. In New York State, we have a form that's called MOLST, MOL, that's Medical Orders for Life-Sustaining Treatments, and it goes through everything. Would you like to be hospitalized? Would you want hydration, nutrition, transfusion, dialysis, ventilator management, artificial nutrition, hydration? All of that is addressed. So you could fill that form out with your doctor. It's duly witnessed, and that's good for life. That's your known wish. It can be renewed every 6 months, but it's in your chart with the doctor. And God forbid, when the time comes, somebody needs to make that decision, he or she could speak for you and be your voice because you wrote it down, took the time to write it.
Well, thank you so much. This is so informative. And as I get older, it becomes more and more of a concern. And thank you for sharing everything you've shared with us today. Thanks so much.
Thank you.
And that brings us to the end of our program today. Thank you for tuning in and learning alongside of us. For more information about our show, please visit us at www.zormed.com and stay updated with South Brooklyn Health by visiting us online. This broadcast was brought to you by Brick Media in partnership with New York City Health and Hospitals, South Brooklyn Health. Until next time, be safe and stay well.